Hello, Mr. Denning.
How are you doing?
I'm good, how are you?
Very well, thank you.
My name's Josie. I'm going to be your student occupational therapist today from the University of St. Augustine.
Okay.
So, you had a right wrist sprain 1 week ago.
That's correct.
That's correct? Okay, and then can you tell me where we are right now?
Yeah, we're at the University of St. Augustine.
And can you tell me why you're here?
I'm here following a wrist sprain 1 week ago.
1 week ago? Okay. And do you know the date?
The 22nd of February.
Okay. So, since your injury is so recent, we are going to use a cold modality to decrease the pain and the swelling in your wrist. So, have you ever used an ice pack before?
I have not, no, not on my wrist.
I think most people have used an ice pack in their life, so this is just what you would typically think of when you have an ice pack. So we're going to put it on your wrist, and we're going to wrap it all the way around and leave it on for in between 10 and 20 minutes. So I know that you're a teacher, and you can't really, we want you to rest this wrist as much as you can, but I know that sometimes you're going to have to use it throughout the day, so it's going to get tired and achy. And I'm thinking that maybe during your lunch break, if you could take 20 minutes and just ice it, it might make it less painful and better able to use for the rest of the day.
Okay.
Okay, so I'm going to ask you a few questions to determine if you're a good candidate for this. Do you have any sort of hypersensitivity to cold or cold allergy?
Oh, I do not.
Okay. Do you have any nerve damage in this hand
No.
that you know of? Okay. Have you ever noticed that your sensation is decreased on that side at all?
No, never.
Okay. And I'm going to check your skin. You don't have any open wounds or anything?
No.
Good skin integrity. And can I have you put both your hands out like this? I'm going to check for sensation. So just let me know if these feel the same.
Okay.
Same?
Same. Same.
Okay. So I've determined that you have intact sensation and your intact cognition, so you're a good candidate for this modality. So we're going to circumferentially wrap your wrist.
Okay.
So since your wrist sprain is kind of pain and swelling throughout, we're going to wrap it so it goes all the way around.
Okay.
And while you're doing this modality, I want your wrist to be in a comfortable position, and if you can, put it in an elevated position.
Okay.
So if you're laying on the couch at the end of the night and you want to put it up on a pillow like this, that would be even better. Okay, so I'm going to grab the ice pack, and this is your ice pack. You're just going to check that it's all intact. You don't have to get one of these. You can make one at home with just a bunch of ice cubes and a towel. And I'm gonna wrap it in a towel, and this is up for patient comfort. So if it gets too cold for you, then you put another layer of towel, or if it's not cold enough, you can make the towel wet, and that will make it a little colder, and you'll feel the coldness faster. So you're gonna go through a period where it's coldness, and then burning, aching, and numbness.
Okay.
And this modality is gonna go on for 20 minutes.
Okay.
So you're gonna leave this wrist pack on for 20 minutes. All right. So I'm going to have you lift up your wrist and put it underneath. All right, and wrap it around like this.
Okay.
Are you comfortable here?
I am.
Okay. So we're going to put the timer on for 15 minutes, and I'll come back. Here's a bell. All right. So I'm checking you throughout your treatment. Skin looks good. All right, we're going to take it off. And do you think that this is something that you would be able to do at home?
Absolutely.
Can you explain to me what you would have to do?
Of course, I would have my ice pack in the freezer, and once it's been in there for a good amount of time, I'll get the ice pack out, wrap it in a towel as necessary to get the right amount of cold, and then elevate my wrist if possible, make it comfortable, and wrap the ice pack and towel around my wrist circumferentially.
Okay. And I just want to emphasize that this is going to help you decrease your pain, decrease your inflammation, so that you'll be able to better do your activities at your jobs, like doing the crafts with the kids or picking up book packs and stuff like that.
Excellent.
All right. Do you have any questions for me?
No, not at all.
Okay.
Thank you.